All right, chapter 31, environmental emergencies. We're going to talk about this real quick, run through it. So, exposure to cold. This can be a pretty serious emergency for patients, depending on how cold. How the body loses heat. We can lose heat through conduction, either through direct contact or water chill. We can lose it through convection. Air or water can carry heat away. Radiation, heat is picked up by surrounding air or water. Okay. Evaporation occurs when the body perspires or gets wet, and respiration is the loss of body heat through exhaled air. So we're doing multiple of these on a daily basis, right? There's kind of an example of how those things are happening. Body heat is lost in nearby objects through direct physical touch. So if he's on cold sand, I don't know what he's on, but if he's on cold sand, that could be conduction. Evaporation, if he's got wet skin, right? Respiration, he's breathing, so that's going to breathe off some hot air. Convection, body heat is lost to surrounding air. Radiation, body heat is lost to the atmosphere and nearby objects without physically touching them. So hypothermia, it's exposure to cold which reduces body heat. The body is unable to maintain proper core temperature. This hypothermia can lead to death. This is a serious factor if we're not careful, okay? Some predisposing factors, injuries, chronic illnesses, and then geriatric and pediatric patients. So our generalized hypothermia, we're going to have some obvious and subtle exposure. Alcohol ingestion can affect underlying illness. Overdose or poison can affect this. Major trauma, outdoor resuscitation depending on the temperature, or any kind of atmosphere with decreased ambient temperature. Okay? So, the effects of cold temperature on older adults are immediate for geriatrics. All right? During winter months, many older citizens on small fixed incomes live in unheated rooms or rooms that are kept too cool. This environment plus slowing body systems, right? They're not up to speed. They're older. They can lead to hypothermia. Also for peds, infants and young children are small with large surface areas, just like burns. They have large surface areas, have little body fat. They're especially prone to hypothermia. They're unable to shiver, much due to small muscle mass. So these folks can get cold quick. So we're going to start off shivering in the early stages. Numbness or reduced or lost sense of touch. We may become stiff or rigid in posture, have some drowsiness, rapid breathing or pulse, or slow or even absent breathing. Okay? So if a patient's not shivering and they're cold to the touch, what does that likely mean? They're not shivering and they're cold to the touch, they're probably already past that stage and they're into some advanced hypothermia. Alright, so how would we assess this patient that's not shivering? First thing I'm going to do is I'm going to come up and feel for a carotid pulse. And I'm going to have to feel for a long time because remember that it said that their heart rate may drop. So they may have a very bradycardic rhythm. So we're going to feel for that pulse for a good 30 seconds. If we don't feel a pulse after 30 seconds on this cold patient, we're going to start CPR. Okay? So there's two different types of rewarming depending on how cold and how serious this is. Passive rewarming is best if it can be accomplished. We're going to cover the patient up, remove wet clothing, get them dry, get a lot of blankets on them. If they're more serious, then we need active rewarming, where we apply external heat sources. Active rewarming can be dangerous because it can send that cold blood that has built up lactic acid to the heart, which could cause cardiac arrest. Okay, there's an example of some active rewarming. They've got hot water in what looks like a trash can, and they are actively rewarming the foot. That can be pretty dangerous if it's just one extremity. So just use caution. Extreme hypothermia. Patient is unconscious, has no discernible vital signs. Heart rate can slow to 10 beats a minute. Very cold to the touch. If no pulse, we're going to start CPR with AED. If the pulse is present, care for them as an unresponsive patient. The saying "you're not dead until you're warm and dead" is a saying we use often in EMS, right? You're not dead until you're warm and dead. That is very true. Hypothermic patients can live a very, very long time at that cold state. So our goal is to get them warm and dead. Our goal is to get them alive. But if we can't get them alive, they need to be warm and dead before we give up. Okay? So, with that being said, if there's no pulse, we're starting CPR with AED. We're going to continue to work them until they're body temperatures come up. Most commonly affects the ears, nose, face, hands, fingers, and feet for localized cold extremity or cold injuries. The blood flow is limited by vasoconstriction. Remember, our body squeezes down, shunts towards the core. The tissues freeze and may form ice crystals. Okay. Early superficial is called frostnip. They can remove from cold and cover. The later or deep stages called frostbite. We have to cover and immobilize gently. Look at that. Ugh. So, once again, patient care, we're going to remove all wet clothing. We're going to actively rewarm patient during transport. Provide care for shock. If alert, give the patient warm liquids at a slow rate. And transport patient unless it's a very mild case. If the patient is unresponsive, we're going to open the airway, provide high concentration oxygen. It has been passed through a warm water humidifier. We don't have those on our ambulance, but if you do, that's great. We're going to wrap patients in blankets, and we're going to transport immediately. So, rewarming of frozen parts. This is seldom recommended. There's a chance for permanent injury. Only if medical direction instructs you to. Warm water in a container in which you can immerse the entire site of injury without touching sides or bottom. I would not do this, but there you go. Active rapid rewarming of frozen parts. Heat water to between 100 degrees and 105. Fill the container with heated water. Remove clothing, jewelry, bands, or straps. Fully immerse the injured part. Do not allow area to touch the sides or bottom container. Stir the water. If you complete rewarming, gently dry the affected area and apply a dry, sterile dressing. Keep the patient at rest. Make certain to keep the entire patient as warm as possible. Continue to monitor the patient, assist circulation according to local protocols. Do not allow the limb to refreeze. Transport as soon as possible with the affected limb slightly elevated. I would not do that, but if you are interested in it, you call the doctor, get orders. Heat on the body. How does heat affect the body? Heat that is not needed for temperature maintenance and not lost creates hyperthermia, right? Hyper, too hot. Left unchecked, hyperthermia can lead to death as well. Heat cramps and heat exhaustion occur on the way up to heat stroke. So heat cramps and heat exhaustion, moist, pale, normal to cool skin. Heat stroke, hot, dry, or possibly moist skin. So, heat exhaustion. Sweating continues, the body loses salts. Salts are important. The loss of salts creates cramping. Loss of salts creates cramping. Loss of salts creates cramping. Healthy individuals may experience a form of shock brought about by fluid and salt loss. Often occurs before people have been acclimatized to summer heat. So, our assessment, we might find muscular cramps, weakness or exhaustion, rapid shallow breathing, weak pulse, heavy perspiration, or loss of consciousness. We want to remove them from the hot environment and administer oxygen. We want to loosen or remove clothing. Position supine with small sips of water. Apply moist towels over cramped muscles and transport. Condition known as heat exhaustion. As sweating continues, the body loses salts, bringing on painful muscle cramps. Healthy individuals may experience a form of shock brought about by fluid and salt loss. Often occurs before people have been acclimatized. Did I just say that? Did I go backwards? So what are we going to see? Rapid shallow breathing, full rapid pulse, generalized weakness, little to no perspiration, loss of consciousness or altered mental status. These people may be very confused. They may be combative. We don't know. They're going to have dilated pupils. If I haven't told you this yet, look at every single patient's pupils. Look around the room. Judge people's pupils. When I'm doing an assessment, I am looking around the room and I'm checking people's pupils. I am looking to see how big their pupils are, okay? So I look at the patient's pupils. I look at somebody else's. I almost said I look at my own. I look at somebody else's pupils and I judge and I try to decide, is everybody's pupils about the same size, or is the patient just really got huge pupils, right? Are they just huge black pupils? Because if they are, there's a good chance they're dilated for a reason. Maybe they have, maybe they are just dehydrated. Maybe they've got drugs on board. You know, if they're really constricted, I'm thinking maybe they're using opioids, okay? So I always look at their pupils. Have they had seizures? We want to remove them from hot environment, remove clothing, apply cool packs to the neck, groin, and armpits. This is called active cooling. Administer oxygen and transport immediately. Infants and young children, cooling is started using lukewarm water. We don't want to get them going too fast. We can actually make patients shiver, and shivering when they are hot is not a good idea because they're going to start increasing the heat again. Water-related accidents included boating, water skiing, windsurfing, jet skiing, diving, scuba diving. Okay, we can have an airway obstruction, cardiac arrest, signs of heart attack, injuries to head, neck, back, internal injuries, generalized cooling or hypothermia, substance abuse, and drowning. Okay, drowning, according to the World Health Organization, is a process of experiencing respiratory impairment from submersion, immersion in liquids. You can die, you can morbidity, or you can have no morbidity, right? Often begins as person struggles to keep afloat. When they start to submerge, they try to take one more breath. Water may enter the airway, followed by coughing and swallowing, and involuntary swallowing of more water. Okay, reflex spasm of the larynx is triggered, sealing the airway. Unconsciousness results from hypoxia. Some who die from drowning die just from lack of air. Most attempt a final breath, and water enters the lungs. So we want to begin rescue breathing without delay, because remember, it wasn't a heart problem, it was an airway problem. If you reach a non-breathing patient in water, support the patient in semi-supine position and provide ventilations. You may encounter airway resistance. We'll probably have to ventilate more forcefully than other patients, and do not delay your transport. Assume unconscious patient or patient with head injuries has neck and spinal injuries as well. Resuscitation to be started before you immobilize the neck and spine, right? So, are we worried in this instance about airway and breathing and circulation, or are we worried about a spinal injury? If they're dead, it doesn't matter if they have a spinal injury. What matters is getting them breathing, getting air into their lungs so they stay alive, okay? Take care to avoid aggravating spinal injuries, but do not delay your basic life support. When possible, keep the patient's neck rigid in a straight line. Information supplied to dispatch or hospital from the scene during transport is critical. Diving accidents. Diving accidents. Most involve head and neck, but many also involve spine, hands, feet, and ribs. Emergency care is the same for any other patient outside of the water. Scuba diving. I think there's something about your chest, on your chest on this too. You get an arterial gas embolism, which is gas bubbles in the bloodstream. The diver holding breath may be due to inadequate training, equipment failure, underwater emergency, or trying to conserve air. Decompression sickness, when the diver surfaces too quickly from deep prolonged dive, takes 1 to 48 hours to appear. Okay, signs and symptoms on an air emboli. It's going to be blurred vision and chest pains, numbness and tingling sensations in the extremities, generalized weakness, possibly paralysis, frothy blood in the mouth or nose, and even convulsions. You can have rapid lapse into unconsciousness, respiratory arrest, and cardiac arrest. Decompression sickness, you're going to have personality changes, fatigue, deep pain to the muscles and joints, also called the bends. Itchy blotches or mottling of the skin, numbness or paralysis, choking, coughing, or labored breathing. It may be similar to intoxication. You're going to have some chest pains, collapse leading to unconsciousness. Once again, our emergency care is going to be pretty much the same. Okay? We're going to maintain an open airway, administer highest possible concentration of oxygen by non-rebreathing mask. We're going to rapidly transport and contact medical direction for specific instructions. We keep the patient warm, position the patient either supine or on either side, and continue to monitor the patient. Water rescues. Water rescues, we have the reach, throw, row, go acronym. Okay? We always try to reach for them first, throw something to them. If we have to, we can row a boat out to them. Or worst case, go, we can swim to the patient. Okay? Ice rescues. We want to protect ourselves. Throw the flotation device to the patient. Toss the rope with a loop. Push out, flat-bottomed aluminum boat. Lay ladder on ice to distribute weight of rescuer. Okay? With these, we're going to treat the patient for hypothermia. Always transport. We never work alone, and we do not walk out onto the ice. Never walk on ice. If you have to crawl or lay flat, if you're trained to do so, that's okay. But walking on ice is a bad idea. Bites and stings. All spiders are venomous. Insect stings and bites are rarely dangerous. Anaphylactic shock is a major concern for those that are. We have to remove the stinger quickly. So this is a brown recluse spider bite. So, if you have anything about spiders on your chest, I'd say we talked about a brown recluse spider bite and that ring that may not be painful upon first bite. Okay? Altered states of awareness, noticeable stings or bites on the skin. There may be puncture marks, could be blotchy skin, localized pain or itching, or numbness in a limb or body part. Maybe swelling or blistering at site, weakness or collapse, difficulty breathing, abnormal pulse, headache and dizziness. Maybe chills, fever, nausea and vomiting, muscle cramps, chest tightening, joint pain, excessive saliva formation, sweating, anaphylaxis, which we know is the airway closing shut from an allergic reaction. Treat for shock, call your medical direction. If your EMS system does not have a specific protocol for care, remove this stinger or venom sac with gloves and be careful. We want to remove jewelry from the affected limb. Place constricting bands above and below site or bite site if local protocol allows. That's going to be independent. And keep limb immobilized. Snake bites require special care but are not usually life-threatening. Death is not sudden unless anaphylactic shock occurs. Keep patient calm and at rest. Pressure immobilization bandage may be most effective technique to slow the venom spread. I think they've gone away from that, but I don't think that's any test either. So, noticeable bite on the skin, which may appear as nothing more than a discoloration, pain and swelling in the area of the bite, which may be slow to develop, rapid pulse, and labored breathing. It's going to progress into general weakness, vision problems, nausea, vomiting, seizures, drowsiness, or unconscious. We want to call medical direction, treat for shock. Keep the patient calm, locate fang marks, remove any jewelry on extremity, keep any bent extremity immobilized. Do not suck out the venom. Do not suck out venom. Do not suck out venom. Can occur in a variety of ways with poisoning from marine life, eating improperly prepared seafood or poisonous organisms, stings and punctures. Fresh water activates toxins on the skin, increasing pain. Use salt water to rinse the affected areas. So if you get bit by or stung by a jellyfish, salt water rinsing helps, okay? All right, guys, that is it for this one. Next up, all we have left is a quick review.